VEGF suppression. So it leads to fibrovascular proliferation and accelerates the fractional retinal detachment. What happens is that once the injection is given and the time for the injection passes off, if you do not have a follow-up on these babies, they can land up with this kind of separation, which is a very, very aggressive kind of disease that a child can have. It occurs within a mean of 70 days, may occur as early as 1 week. The accelerated course differentiates it from the progression of ROP in normal course, and it may be arcuate, pre-papillary, or nasal. Now, we had a total of 106 AROP babies, and we listed it down to 10 babies who had crunch phenomenon. Now, amongst these 26 were referred from neonatologists, which they were by a national progression, and others, 27, were referred from ophthalmologists, which was as the second or the third opinion. So this was the data analysis. There were more females than males, and it was ranging maximally in the 28-weeker group. 16 were bilateral, 2 were unilateral, and the prevalence was more in the 800 to 1,000 age group. Now, in the data analysis, we found that laser was done in half and not done in half. And in the injections, the 9 patients were of ranibizumab, bevacizumab, and 7 were from ranibizumab injections. So the data analysis also showed that less than 7 days in one patient, it occurred between 1 to 4 weeks in 2, and greater than 4 to 8 weeks in 7. Now, out of the 54 AROP babies, 10 infants, that is 18 eyes, 2 were spared. All had anti-VEGF injections for battling ROP, occurred bilaterally in 8 patients and unilaterally in 2 patients. And when referred from the neonatologist versus referral from ophthalmologist, we found that it was a statistically significant figure. And this is the case series. There were 2 who regressed after the laser, so they were not in this fray. And the others had a combination of either laser and injections as well as surgeries in some. So only fill-in barrier was given in 3 children. Fill-in laser with intravitreals in 8 patients, fill-in laser with intravitreal followed by surgery in 6 patients, stage 4 surgeries in 2, stage 5 surgeries in 2, and best left lone eyes were in 2 cases. And out of the 18 eyes, we found that 13 did well and 5 did not do well, they were lost. So this is a half-zone ROP, which you see in that thing. There's hardly any, this right up to the arcades. And this is another case of crunch, which you see on the right side, and the laser done. So the results is that out of 18 AROP eyes developed crunch phenomenon. On comparison of results, we found that the direct referral was more statistically, the referral from the ophthalmologist was definitely more than that from a neonatologist, and of which 18 AROP eyes with crunch phenomenon, 13 did well, that is 72.22%. Quiescence was seen in all of them, and 5 eyes did not have this. So on comparison of results of AROP with crunch phenomenon, present or absent versus status of disease quiescence was again seen to be statistically significant. There were surgical dilemmas because these were elastic, tenacious, and fibrous, multi-layered, and surgical approach was directly from the disc towards the periphery. And the prevention was the most important thing because this happened in AROP babies. So don't be fooled by apparent disease quiescence. ROP crunch mostly occurs in AROP eyes. Careful, timely close-up, and better to follow up anti-VEGFs with laser by 3 weeks or 4 weeks. Anti-VEGFs preferably avoided in advanced stage 3 or stage 4 cases. Aggressive surgical treatment recommended in all these diagnosed cases. Thank you so much for your kind attention.
That's a nice presentation, Dr. Karobi.
Thank you.
So one question. Was there a correlation between worsening of the weight or any other systemic diseases to the crunch which happened? Was it the same? Was it the same?
No, I didn't get your question. Worsening
so
of?
The baby, you're given injection, and we expect the babies who gain weight and who become systemically better, they fare well. Were these patients who had crunch? Was there a correlation that was it because of the deterioration of the systemic or its injection alone? Was there a correlation?
Yes, we had a total of 106 eyes, that is 54 babies, out of which there were only 20 who had landed up with crunch. Now, these came in different time zones, means when they were referred as a second and third referral, by that time the child was a little older because they were seen by an ophthalmologist, given the injections over there, landed up with crunch, and then they were sent. So the thing is that the time frame was a little different. By that time, the child was not in the NICU, the child was out of the NICU at home. So there was no involvement of any kind of systemic problems at that point of time when we did see these children. And the ones from the neonatologists were ones which I followed up from 3 weeks onwards. So those were the children
That's
who
what
were
I meant.
treated
If you
for
had
systemic.
included only primary referrals, it would have given, because when the patients are referred from outside, you might miss out on that. During that 1 month was there a stormy period, which can give rise to this.
No, they were all AROP babies. So they were very stormy.
Right.
These babies, they had like a 360 zone avascular retina, and they had been given the injections maybe at third week, fourth week. But on the follow-ups, probably the follow-ups were not done on time. And when the patient landed up, means you have a disease quiescence, it looks good. So the patient goes to the to the ophthalmologist. He says everything is fine, but the blood vessels have not touched the periphery. Then suddenly they go after 2 or 3 weeks, and boom, the whole thing comes up again. So that's how they were sent as a
Thank you.
second and third
Thank you.
referral.
Is it possible that the babies received the first treatment itself late in these cases, when they already had some amount of beyond stage 3 and excessive fibrosis?
That's what I said. Some of them were injected at advanced stage 3 also.
That could probably another contributing factor.
It could be. Yeah. We didn't get into the logistics of what somebody had done. We just got into the logistics of the crunch effect which occurred
Yeah,
later.
the discussion can go on just for the one.